Hello and welcome to Rhode Island. My name is Dr. Gabrielle Lieberman and I'm the Chief Resident at the NYU Langone Dental Medicine Advanced Education and Pediatric Dentistry program in Providence, Rhode Island. I'm going to spend the next couple of minutes talking about our Rhode Island site with you. The leadership of the Pediatric Dentistry program is led by Dr. Daniel Kane, who is the director of all the NYU Langone Advanced Education and Pediatric Dentistry sites. We at Rhode Island have the privilege of working with Dr. Kane as he is based primarily out of our site, and it's a pleasure building a relationship with him, and he can be a very valuable resource to have. The pediatric dental residency programs are sponsored by NYU Langone Health. Dr. Kane is supported by 3 senior associate directors, each responsible for different regions in the country. There will be times throughout the program where you have the opportunities to speak with these directors on different occasions, and locally there are associate directors that are located at each of the training sites in each of the states. We in Rhode Island were the first satellite site developed for pediatric dentistry, and it is launched at our main site, St. Joseph's Health Center, where we spend predominantly most of our time. The second year class and first year class are both comprised of 4 residents each, leading to a total of 8 residents. There are different reasons why our residents rank this site, just to name a few: the clinical experience, the GA and sedation experience, having the unique opportunity to do cleft lip and cleft palate, and also the location. You can appreciate the difference in what one year does, as our first year residents started their residency off during COVID. I do have to add our group of residents are very close and enjoy working together. When speaking with the residents throughout your whole course of the application process, look for camaraderie between the residents. Residency can be very vigorous and demanding at times, so having a strong group to help you through it is very key. Our Rhode Island program includes 5 different locations, and at St. Joseph's you get a very diverse clinical experience in providing a dental home for children from families with low income. There are a wide variety of services that we offer, and our residents graduate from our program ready and qualified to walk into a private practice with how much clinical experience and exposure to different situations you will receive here. I would say the most unique service to our program is our craniofacial experience. But also with the new COVID protocol, we're becoming more immersed in other services to be able to fit our patient treatment needs, such as Hall crowns, SCF, and smart restorations, where there's no local anesthesia, no caries excavation. So it's a great solution for poor cooperation in the state of our country and all the precaution that is good resource to use non-aerosol restorations. So here at Rhode Island, we have about 1 attending per 3 to 4 residents at a time. We're very grateful to have all of our attendings. They provide such a great impact to our program. They love to teach and believe that their knowledge is to be shared with the future of pediatric dentistry, and they always make themselves available during and after hours for any questions or concerns you may have. Our morning huddle is at 8 a.m. and will go until about 4:30. And each resident is assigned their own chair and dental assistant. You will have nitrous or protective stabilization available to you. And depending on what year you are, and obviously now with COVID, the appointment times are a little adjusted, but you will probably see about, at a minimum 7 patients a day, 8 patients a day, on the up of 15 plus at times. You will also get familiar with the Didactic software. We have sensors in the OR, but we use phosphor plates for radio feedbacks in the clinic. In St. Joseph's, we also have the opportunity to work with an oral surgeon, which you will have a lot of OS experience here. The oral surgeon's available to us for consults, exams, questions, or any concerns. You will get experience with canine exposures, wisdom teeth extractions, biopsies, frenectomies, and much more. We hold a suture workshop at the beginning of the year that is hosted by the oral surgeon typically, which is always a good refresher before taking call at the hospital, because there will be a few opportunities for you to do sutures there as well. We have the pleasure to spend our Monday mornings with different orthodontists. We have a variety of ways on learning about ortho here, from lectures in their private practice that covers topics like orthodontic cases, treatment planning, procedures. There are also orthodontists that volunteer their own time, providing us the clinical ortho experience. You will gain experience in habit breaker appliances, palate expanders, lower lingual holding arches, the Nance appliance, to full bracketed cases. Like I mentioned before, there is a unique opportunity here at this site. You have the craniofacial experience, and there's more than one opportunity to have this experience here. To mention one now, there are patients that are followed from birth and seen in our clinic. You'll see babies with cleft lip and or cleft palate, and how to make and adapt the nasoalveolar molding appliance to bring the lesser segment and greater segment closer together, elongate the columella, which helps with the surgery later on. You will also gain experience with working with the parents and training them how to utilize this appliance at home. You will also gain experience with treating patients with special healthcare needs. And for an example, spinocerebral ataxia, capillary malformation, hyperextended joints, relative macrocephaly, agenesis of the corpus callosum, cerebral palsy, autism spectrum, mitochondrial disease, DiGeorge syndrome, Sickler syndrome, sickle cell, and much more. Our administrative staff consists of a dental manager, education coordinator, and clinic coordinator. This is how our program stays alive, running, and all work very hard behind the scenes for us to have the residency program that we do. They work on our schedules, our requirements, scheduling our sedations and general anesthesia cases, calling and confirming our patients, to reaching out to the physicians to require the history and physicals, our 30-day pre-op appointments, to COVID testing appointments, cancellations, rescheduling, you name it. They're going to be able to do that all for you. We also have an amazing staff of dental assistants that are all certified interpreters, and we also have a language line if needed. Here's our front desk and billing staff, and at St. Joseph's you will not have to worry about finding your own patient pool, establishing extensive treatment plans, calling or confirming your patient. That's what our front desk is there for, and they confirm our patients, making your life that much easier and ensuring the patient receives and fills out all the proper paperwork prior to them even coming back to see you in the operatory. So our second site we have available to us is Our Lady of Fatima. It's the hospital where we get to do our general anesthesia and sedation cases. The NYU Langone Dental Medicine PEDS program places a large emphasis on pediatric sedation, pediatric general anesthesia, and pediatric medicine, with the residents completing more than required by CODA guidelines. Graduates of the program are trained to be an integral part of the medical team and hospital environment. Here is where your first year phlebotomy and anesthesia rotations will be held. Phlebotomy is an essential part of medical diagnosis, procedures, and tests, where you'll learn how to draw blood and get familiar with the tourniquet, the catheter. During anesthesia rotation, it's a 20-day rotation that starts about 6:30 in the morning, and you will learn to get familiar with starting IVs, induction, intubation, placing airways, and masking your patients and breathing for them, all very important in emergency situations to have these sets of skills. As I mentioned before, you do not have to worry about finishing your general anesthesia requirements at this site. All of us second years have completed our cases very early on. In terms of sedation, each first year and second year are provided with responsibilities to get fully immersed in the understanding and importance of patient selection for oral conscious sedation. You will draw your own meds. You're going to calculate your own sedation and emergency medications. You will review the case thoroughly with our attending and have a distinct plan of action. You will gain experience with behavioral management skills, and our attendings understand that every state has a different protocol and rules for oral conscious sedation. So leaving this program, you're going to be able to get comfortable with Versed, hydroxyzine, meperidine, as well as using the different combinations and when to use them. You will feel prepared in whichever state you're working for to perform this oral conscious sedation if you so choose. Our third site is the Rhode Island Children's Dentistry and Orthodontics just in East Greenwich, about 15-minute drive from Providence, maybe 20 minutes. Coming back to that unique opportunity we have with the craniofacial in-office team, we have, just like you have at St. Joseph's, you have the opportunity to go into their private practice, and you will be able to see them work with other attendings, learn management of frenulums with lasers. You'll get the experience with consultations of frenectomies. They also have the opportunity to have an interprofessional experience, seeing a nurse practitioner providing lactation and nutritional advice, which is pretty cool. Our fourth site is the Hasbro Children's Hospital. It's about a 5-minute drive from our main site at St. Joseph's Health Center. It's a Trauma 1 Center unit, and this is obviously something you really want to know because this is where you're going to be taking call. So residents are on call for 1 week at a time, Monday through Friday from 4 p.m. to 8 a.m. And then on weekends and holidays, we are on call from 8 a.m. to 8 p.m. Call is not in-house, therefore you're required to live within 20 minutes of the hospital in order to respond to call. You are never on call by yourself. A second year and a first year are always paired up at first and as first and second call respectively until about December of your first year, where the first years will then take call. But the second year is there for guidance, assistance, and advice. Our attendings are also available for phone consultation and if there's ever a situation of uncertainty. You become very experienced with different dental traumas with primary and permanent dentition. You also can get your sedation cases here as well as intranasal Versed or IV ketamine that can be utilized depending on the cases. We take call all night long, so you can see 4:30, a 2 a.m. case, 3:45 a.m. case. So you definitely have to be prepared and ready to work even throughout the night. So at Hasbro, you will also have many of your rotations here. The majority of them are done during your second year, except for one, which is our emergency medicine, which is done during your first year. But to name a few that you'll do in your second year are refugee clinic. And you'll also have the opportunity for LEND. Only 1 to 2 of the residents are selected to participate in this your second year. But it's a great opportunity for you to have that interprofessional experience where you're working with different doctors, social workers on different type of neurodevelopment disorders and disabilities, working with these families and figuring out how they work with their child of need. You'll also have hematology, oncology rotation, sickle cell, inpatient medicine, all these rotations. Like I mentioned, you get that interprofessional experience, which is really great. And our fifth site is our Providence Community Health Center, also 5 minutes away from our St. Joseph's Health Clinic. So everything is very easy to commute, which if I didn't mention, you will need a car to commute to all these different sites. But PCHC is a federally qualified health center. It is so beautiful. It's one of our newer sites, and it's just another amazing group of attendings that are there. They're always there for advice, providing feedback. They're always ready to share articles with you to address any questions of yours. They work with you and help you study for boards, and they encourage you to try different materials. If we provide a reason or show them an article for wanting to try new material or procedure, they will order it and let us try it. Huddle is typically around 8 a.m. with your first patient scheduled at 8:30, which gives you plenty of time to discuss your schedule with your assistants, review anything important or anything of concern with your attendings. Just like St. Joseph's, you will have your own opportunity and dental assistant. You will also have the opportunity to meet with an oral surgeon here as well. And nitrous and protective stabilization, same software and digital radiographs here, which is a great addition. You'll have your teaching rotation at Tufts. This is the one time during your second year that you actually have to commute outside of the state, but it's a great opportunity to learn from different attendings, see how another residency program is learning and how they teach, and also you get the opportunity to teach the undergraduate dental students. So clinical requirements will obviously depend and change as you go from first into second year. And like I mentioned a lot of these rotations already throughout our talk, but you'll see pediatric medicine, phlebotomy, OR cases, inpatient pediatric medicine, where these patients are in the hospital dealing with different types of cancers, sickle cell crisis, and you're learning how to manage these patients and can also provide any sort of dental clearance for them. So typically at the start of your year, you'll receive this sort of master calendar. They are usually scheduled for your entire year before July 1, and you will have different AM and PM sessions. The whole idea of having this is trying to make the different adjustments. That way, if you're getting something that maybe your other co-resident isn't having, adjustments are constantly made to ensure everyone is getting a comparable experience. And then you can see the difference here with your master calendar compared to your first year. The second years are going to have a little bit more rotations, a little bit more responsibility as you get more familiar with the residency program. So just like every other NYU Langone site, there is a didactic portion where one day of the week you meet for a video teleconferencing where all the sites log on and listen to lectures on a variety of different topics, and each resident has assistant modules that are due monthly and literature review that occurs anywhere between once and twice a week. Here you'll see across the board many NYU Langone sites are recipients of so many awards, and many of which are graduates of our Rhode Island site, which is really nice to see how well qualified you are after graduating from the NYU Langone programs. Here too, more recipients, and our pass rate for qualifying exam and attaining board certification are greater than the national average in the past. Hopefully we can continue to keep that up. So our residents receive a generous stipend and 25 days paid vacation per year. You also get an additional 4 continuing education days that you can take and help further your education. And you will get stipend for books or any sort of extracurriculars that you want to do to better yourself. You have community outreach opportunities, Mission of Mercy, Providence Night Out. We try and get out into our community. Obviously, COVID is holding us back a little bit, but I'm sure we'll come up with something sooner rather than later. So Rhode Island has so many things to offer outside of our residency. And there's affordable housing options. They're all available within 20 minutes of the hospital, depending on if you're single, married with kids, and who just doesn't love food. I go everywhere that I can I surround myself with food at all times, and so do all my other co-residents as well. There is a place called Little Italy, actually called Federal Hill, but it's our Little Italy if you're from New York area. Outdoor seating, live music, dancing, all of course pre-COVID. Rhode Island has its own culture and their own treats that are unique to the area, from Dell's lemonade, coffee milk, which you're gonna see a ton of your patients drink at home. If you're a sports fanatic, this is also a great place to be. They have the home of the Patriots, the Bruins, Red Sox, all within an hour drive from Providence, which is great. And if you want to go visit New York City for a short or longer weekend, it's very accessible to you. It's about a 3.5 hour commute. And they have buses that go to and from as well, which make it very easy. So we have the beaches, the Cliffwalk Mansions. If you're a Taylor Swift fan, she has a house in Rhode Island that you can go and see. There are vineyards, hiking. I know I mentioned food, but the seafood here is delicious and so fresh. So make time for your co-residents. Make sure you try and get out a little bit. It becomes your extended family, and you definitely want to make sure you're enjoying as much as you can. As like I mentioned, residency can be demanding at times. So all of our graduates graduate well prepared for whatever their next endeavor is. I'm so very happy to be here. I feel that I will be a competent pediatric dentist upon graduation from all the clinical experience I have received, the guidance and advice provided to me from my attendings, and the relationships I have gained that will last a lifetime from my co-residents and my attendings. So thank you so much for your time and interest in our program. We wish you all the luck in the application process and your future endeavors. I hope you enjoyed this presentation and you have a better overview of what residency is like at the NYU Langone Dental Medicine, Advanced Education, and Pediatric Dentistry here in Providence, Rhode Island.